Dr. Fritz Barton studied at one of the top training programs in cosmetic surgery in the country. Since 1976, he's become one of, if not the, leading proponent of cosmetic surgery in Dallas-Fort Worth. And he formed the Dallas Plastic Surgery Institute, made up of the original faculty of the medical school he headed up at UT Southwestern.
The thing I think we're most proud of probably is the fact that all of these guys have been able to develop their own independent identity. We're all confident that we know more than the other guy, but they have their independent identity, and yet we work together as a group, and that allows us to provide a wide range of plastic surgery services, reconstructive and cosmetic, so that we can cover the waterfront. And among the group, there's someone who's at least a national level expert in every sub-area, and that's what we're trying to do.
His philosophy of a full facelift differs from that of some of his peers.
I believe that the ideal time to do it is when the changes are present but early, when they first begin to show. Really taking the philosophy to try to maintain your appearance rather than to lose it and recapture it. And so that being the case, for the average American female, the ideal time is probably mid-40s, not mid-50s. And secondly, not to do just a segment of the face at a time. If you do part of a face and put it under a different tone, then it never quite matches the rest of the face, particularly as people age. And I think that's what we sort of lose track of sometimes, is that you can look really good early from a lot of procedures, but the question is, what happens over the years as you age, and do you still end up looking good, or do you get a face out of what we call harmony? And I think that's a critical issue.
Case in point, patient Lenny, owner of a Colleyville day spa.
Lenny is a very vivacious and attractive young woman who is the typical patient, really, for facelift. The real typical patient is a person who's health conscious, who's active, who's just trying to improve themselves overall, whether it's their appearance, whether it's their clothes, whether it's their exercise, whether it's their diet. It's really someone who's into self-improvement. And like a lot of patients, they come sometimes focusing on one area. In her case particularly, it was her lower eyelids. But as you analyze their face, they begin to realize that that's just one piece in the puzzle.
I didn't like the lines that were under here. I felt like I looked tired all the time. And one of the things that I really didn't like was my smile lines.
It's much better off, in their benefit at least, to keep their face in harmony, keep that tone the same, so that when you do a correction, you end up having it last and you don't go back, redo it, doing little procedures. The problem with little procedures is that they end up with pulled looking, unusual looking faces.
I still look like me, and that's what I like. I see other people that are just pulled so tight and so unnatural, and many people will say they would never ever guess that I've had anything done.
So what's the recovery or downtime?
First 2 weeks you're really swollen, and although you're functionally up and around, you're very socially limited. But then it takes another about 4 weeks, a total of maybe 6 weeks, before you really look better than you started out. But if people will invest another 4 weeks of patience with their social calendar, they'll get multiple decades of additional benefit out of it. Quick and quality never have gone together, and they don't go together in a face either. And I think when you start talking about the face, you only have one, and when you compromise quality, it's something